I think we can go ahead whenever you're ready.
Yeah, I think so too. So I think that there are probably a lot of us, but we have a lot of good advice to give. Welcome, everyone. Thanks for volunteering your time and being here. This is our step one dedicated panel. So we're going to talk about how we structure our dedicated and all that kind of stuff. I think one thing that I've talked about in the email that we talked about before a lot of you guys got on the call is they're retiring basically all of the practice exams that we took. So those are going to go away on March 24th, and they're going to be replaced with the new practice exams that are more in line with the new NBME exams, and they're also going to have answer explanations. So that's one thing to keep in mind when you're giving them advice. I've got my list of which ones I took and when, and I'm not sure if that's going to be helpful to anyone. Okay, so maybe we could start off with some of the questions that we already had. Let me pull them up. So one thing that they are concerned about is balancing step one studying with studying for required lecture and block specific material. So, and Sarah mentioned that they have like a lot of required lectures right now for block 5, and it's really stressful for them going into dedicated. They'll start dedicated on March 23rd is their final CBSE. And up until then, they have a bunch of required lectures. So I don't really remember what we did last year. Does anyone else remember?
I actually looked this up because we were chatting with a couple of your guys' classmates about like how much required stuff you guys have for especially the psych portion of block 10. And we actually had a lot more than I remembered as well. Like we did a lot of like addiction medicine type lectures and a lot of things during psych that I kind of had forgotten about. So if it makes you guys feel a little bit better, there was quite a bit for our class going in as well. I think the hardest part is that as dedicated gets much closer, you are eager to get started and you feel the step one pressure and you're still being pulled in both directions. Um, but I think it's good to kind of remind yourself that you are giving yourself that dedicated time in 5, 6, 7, 8 weeks, however much time you decided you need is actually a lot of time. It will go by fast, but it will also go by slow. So as eager as you are to get started and kind of let go of all of the lectures and required things, some of them are super valuable. Some of them are less, but I think just kind of keeping the perspective that even though you want to get into dedicated quickly, you decided how much dedicated time you need and you'll get all of that. So try not to beat yourself up too much if you feel like you're not getting as much kind of step one progress the last few weeks before dedicated and you're focusing more on what's in the block exams. Hopefully there's some overlap for you guys and you might not recognize it yet, but maybe once you take a CAS exam or once you take an NBME practice test, it'll become more apparent that there is more overlap, hopefully, than you are expecting there to be.
I also think, kind of to go off of that too, I feel like because you guys are learning the site content so close to dedicated, I at least found for myself, and I'm not sure if my classmates can speak on that as well, I didn't really have to review that content when it came dedicated time. So I feel like I really took the time at the end to study it and really master it. So then that wasn't something I was worried about, and that saved me some time in the long run.
Yeah, and one of the things that kind of got me through required lectures, even if I thought it was like over a topic that wasn't really important, I would try and focus enough so that I get like at least a handful of facts or like learning points. And I just told myself, okay, well, I'm going to learn this amount of things and I'm going to like make sure that I do that for each lecture. And that way you're kind of holding yourself accountable to always be, learning and a little bit engaged. And then afterward, you're going to realize some lectures are sort of pointless and a lot of your classmates will kind of shut off or shut down. And I think at least if you do a little bit of that learning for each lecture, it's going to go far, especially for third year.
I think that the psych comment, like the comment about not having to relearn psych is like really, that was spot on for me as well. Like the psych drugs, as I recall, were really pretty high yield. And I think I went over them like again a little bit during dedicated, but I didn't have to like relearn them in the same way that I had to relearn some of the other material that had been a really long time. So it is useful. Like psych is a big part of step one, so it is useful. Okay. Does anyone else have anything for that question?
I mean, I guess my only thing would be like, if it really is distressing and it really, I mean, obviously it really sucks having a ton of required things right before step one dedicated, but just remembering that it's not a sprint, it's completely an endurance test. So if you feel like you're just burning out, no one's going to fault you for not exactly paying as much attention or not getting like the highest block score in the last psych block, because honestly your mental health going into step one dedicated is a huge part of how you're going to conduct yourself throughout it. So like going in there with the tank full of gas as opposed to running on fumes going into dedicated is going to really make a big difference in the upcoming weeks, I'd say. So pay attention to your mental health in the next few weeks.
Great point.
I have a question on this. Did you guys feel like beyond step one, going into third year, like you were more prepared for your psych rotation because you had to go to lectures and learn from that perspective as opposed to just boards and beyond? Or do you think you would have been prepared just fine for third year psych with just like step one studying?
I can talk about that a little bit. I don't. Shelf scores are shelf exams are, in my opinion, so different from like how they test you compared to step one. Where I felt the knowledge from step one is very similar, and psych is one of those specialties where the stuff is pretty limited, right? Like you have your antipsychotics, you have a few like other drugs, and then you have your spectrum of depression and all that stuff. So the good thing about psych is that I don't think there's a lot of complex physiology, right? So I think the basic knowledge that you do get for studying for step one is enough for third year. But obviously there's a lot more like stepwise management that comes with those shelf exams, right? So the questions are a lot different. I don't know. I don't think it's hard because I've been so far removed now from block 10. And for me, it was different. I had block 11 and it was like a huge array of different things. I'll be honest, that's the one difference that I noticed. I'm sure these other third years can speak to it as well. Like I thought that the difference between how to prepare for shelf exams in step one was totally different. Like everyone uses first aid and this and that. I found that at least a lot of my classmates just use questions, right? And so really just studying for whatever the standardized exam was enough. And I think that applies to being on the wards as well. So especially for psych, it's changing. I think we were allowed to go to renal behavioral, Renown, and the VA. Now we're not allowed to go to Renown, and they might be bringing it back. So there's changes. And on the wards, you don't really have to do much other than know how to interview a patient, right? So, and they give you all that material. So in terms of performing well on the wards, for psych specifically, I don't think it's like, there's nothing step one is going to teach you in terms of that, because you just have to be comfortable hearing the same story over and over again. This person's a schizophrenic. He thinks he's president of Wells Fargo, and you have to interview them every single day and report the same thing. And in terms of, like I said, the shelf, I think your step one study is enough. I don't think that the lectures are all that helpful, to be honest. But some other people might have other opinion on that.
Yeah, I kind of agree. I'm on psych right now, and I feel like sort of like what he was talking about, the biggest thing that you're going to have to learn how to do for third year for psych is how to conduct an interview, how to get information from your patients and know when enough is enough, and kind of like going down your clinical decision path of, all right, do I think this person is, like bipolar, or do I think they just have depressive episodes or whatever it is? And what you'll find is that all the information you learn for step one carries over for step two. I mean, surprisingly, you cover a pretty much 90 something % of all the psych diagnoses during your year studying for step one. And I thought that a few of the lectures during the block were helpful. I think it really depends on the lecturer. I think lecturers are hit or miss. So if you get something out of a lecture, like I think Dr. Cotton gave us a very good like delirium versus dementia lecture, to the point where I feel like I haven't, struggled with delirium versus dementia, and I kind of just have it locked in. Whereas some of the other lectures, you might not get as much out of it, so that it's a little bit of a hit or miss on those.
Can you guys hear me okay?
Yep.
So yes, okay. So I think, Sarah, I think what you're asking is you want our opinion on whether or not we believe the required lectures in Block 10 are actually like important to our learning. And I mean, that's a difficult question because one could argue that you don't need any lectures as a medical student. We can do it on our own. And that's fine, but the problem is being a med student is so much more than taking tests. It's juggling lectures and juggling assignments and juggling your studying and all these other things, and you're going to do that the rest of your career. So having to deal with these required lectures while you're also trying to study for a big test is, I don't know, in my opinion, it's an important skill to learn. And doing like what Pascal says, make the most out of those required lectures, because they're not going away. You're going to do them the rest of your life. So that's kind of my take on required stuff.
I think the difference is too, Sarah, that like as someone who's taken step 2, has taken all their shelves and like is already preparing for step 3, the preparation level really goes down, because when you're actually on the wards, like that's already kind of studying on its own, right? Like if you're on internal, psych not so much. I think psych as a rotation is pretty easy. The shelf can be difficult because it seems like you're getting the same question over and over again over the course of like 3 hours. But I think the reason step 2 is easier, shelves get easier, is because you get that exposure, and so you have to study less. So I totally understand like the fact that you don't see this in person, you don't really get to do any management. And now you have all these like obscure lectures that are also kind of hindering your study time, is what makes studying for step 1 difficult. But once you get through step 1, I really think that anyone can, regardless of what you score, I really think that anyone can make the jump to do well on shelves in step 2. I think the average nationwide for like a step 1 score to step 2 increases like 10 points. And I think UNR average is like 14 to 15 points. So we're a little bit above the national average. And our shells have also been going a lot better as well. So I wouldn't worry about transitioning to third year in terms of like the relevant material. You're going to be one rotation in, and you guys are going to be like, wow, this is it. I think everyone overhypes third year, in my opinion. It's definitely is like time consuming. It's hard. You have to study, but once you realize that you just have to use question banks, I think most people transition pretty well. So.
Okay, so we also have a lot of general questions about just dedicated. So suggestions on dedicated studying. How many hours a day did you study? What did your schedule look like? How many days did you take off? What did you do to relax in your free time? So I'll just kick us off. I think that I went into it like hardcore. I'm going to study every single day and I'm going to take step 1. I think my original goal was like 6 weeks of dedicated and then take it. And I'm going to just go every day for 6 weeks and I'm going to be fine and it's going to be great. And then like, I think within 2 weeks I had burned out like really hard and my scores had stagnated. And I was like, I need to study more and be more dedicated to this. And then I came on to a weekly meeting with, I think Laz was there and Brady was there and and everyone was like, wow, you really need to calm down and like take a day off and stop being insane. And after that, literally my scores went up like 10 points immediately just from like no longer beating myself up. So it's not like a linear thing of like the amount of time that you put in is exactly correlated to your score. I think that it's crucial to kind of like keep your sanity during step 1. Like Drew said, it is not a sprint, it is a marathon, and you cannot run a marathon at like a 4 minute a mile pace. You just have to take some time off. So after that, I made sure that I took at least one day off a week, and I like to hike. So I went hiking every week. My typical schedule, I never did more than like pretty much 40 to 60 questions a day. And I would just like review those questions. It turned out that I was a very thorough studier. I think everyone approaches this differently, but I was like, I would study those questions. And then if that brought up any additional material that I thought that I needed to go over, I'd go over that. I'd watch a few videos, and I would do some flashcards of my incorrects. So I kept like a running list of like notes on my UWorld incorrects, but I didn't get to the point of making all of them into inky flashcards. I kind of had the goal of doing it. So it would be like I did my UWorld questions, I wrote it down, reviewed it later, and then like at some point again, I would go back through that list and try to put them into inky flashcards. But I didn't get through nearly all of my giant list of UWorld incorrects, but it was just a way to kind of see that information again. And then every so often I would just kind of like go to a specific point in my list and like read what I had gotten wrong and kind of review from there.
I will echo that it was super important to have a day off every now and then. For me, I scheduled that every Saturday was going to be a day off, and then I actually got to look forward to that. So on the days that were really hard, I would say it's almost Saturday. I don't have to do anything on Saturday. So I really highly recommend that. I know some people would take off 2 half days, so you could have 2 different days to look forward to while still having that same amount of study time. For the days that I was studying, I would get up at 7 and have breakfast. By 8, I would start doing my questions, and I would do 3 sets of UWorld, timed and random, to just sort of increase my stamina, since step 1 is such a long test. After that, I would take an hour break and just have lunch and decompress, after having just glanced over my incorrects. Between 12 and 4, I went through a list that I'd been keeping of topics that were hard for me, like ovarian tumors. I still to this day can't tell you the difference, but that was on the list. And I found a list of common USMLE topics on Reddit or something, and went through and like just made a list of like 80 things that I wanted to cover in that 4-hour chunk throughout dedicated. After that, I would take 2 hours off between like 4 and 6 and have dinner. And I started exercising for the first time in my life because I was so nervous. I needed something to do with that energy. I'd walk my dog, something like that. And then in the evening, that's when I would go over the 120 questions that I had done in the morning in more depth. And I would also add any topics that I needed to do a more deep dive onto that running list for midday in the future. So that was helpful for me because I knew what I needed to do at different times of the day. And dedicated can be such a blur that having that bit of structure was really helpful to me.
I agree with both Katie and Nita. I was one of those people, I took forever to take STEP. I took it like in September. The more I studied, the worse my scores got, and the less I studied, the better my scores got. So I was trying to push the 10 to 14 hour mark because that's what everyone said they were doing. For me, I figured out a good schedule. I am the type of person, I like to wake up first thing in the morning, go to the gym, and then if I'm going to do anything that's like requires a lot of thinking, I do my questions first. And I think both Anita and Katie said that they do their questions first before they do everything else. I can't encourage that enough. Like if you're studying resources in the morning, I think that's the wrong way to go about it. Of course, everyone's different, but I've just heard a lot more consistency across in success stories of people that did their questions first, knocked those out of the way, and then reviewed later. Because I feel you're already a lot more exhausted after you eat lunch. You get that 2 p.m. fatigue, regardless of how healthy and energized you are. And I just don't think you perform the same. And believe it or not, it really is true that if you practice how you're taking the test in real life, so if you do start at 8 a.m., for example, or even 9, it doesn't have to be exactly like super early. And what Anita said, she said she did 3 back to back. I always did at least 2. Katie says she did 60 questions, but I would always do them timed, because I think I've talked to some of you guys about this before, but the problem with doing tutor mode is that you get immediate satisfaction when you get the question right or wrong. And so I don't know if you guys have noticed this even on your block exams or third years during your shelf exams, but like I always felt so comfortable doing questions because I was like, oh, there's no risk here. Like it's all reward. I'm either learning if I get it wrong, and if I get it right, fantastic. And you don't get that positive feedback on any exam, right? You don't get that, oh yeah, I know this is right for sure. And so you need to train yourself to be comfortable and not like going back, and because that was my problem. I never really had a thing with time, but I always did waste a lot of time on some questions, and I would have to speed through others because I was like, oh shit, I can't really know if this question's right or if it's wrong. So I would highly recommend doing them early in the morning, doing them timed. Try to get your stamina up. At least do 80, so 2 sets. That's 2 hours, right? Like if you start at 8, you're done at 10. You know, you can eat breakfast either before or after, and then take an hour break, and then do whatever else you want to do for studying. In terms of wellness, everyone was talking about their time off. I did a day and a half, so I took Saturday all day and then half day Sunday. Usually the half day Sunday would be to review some, like what Katie and Anita mentioned, any incorrects or notes that I might have taken, and I wouldn't actually do questions. So really, I actually only did questions 5 days a week. Saturday was completely off. I'd do some review early Sunday morning and then take the rest of Sunday off. So I could be kind of fresh and ready to go once Monday started up again. But I can't emphasize that enough. Like if you kind of stick to the same schedule that you've been doing in medical school, whether you're a big gym person, walking your dog, painting, whatever it is that you do, I think if you can focus and make that like a part of your schedule, I think you'll be a lot better. And I honestly recommend no more than 10, but do it like a regular work day. 8 hours, I feel like worked really well for me when I turned it down. So
I don't have much to add to that. I also was someone who did questions first and then reviewed later. I feel like that's what most people do. The one thing that I did do is I tried. I was unsuccessful some days, depending on how busy I got reviewing. But for the most part, I would try to do 1 hour a day, whenever that was, to review topics that were a little bit more memorization heavy. So I would go through pharmacology or like microorganisms, like things that I felt like I could forget really easily, that would actually be simple points on the real test if you could remember. And that seemed to work for me. So that's just something I've suggested to some people in your class.
I know earlier I advocated like kind of for the making sure that you're running along like at a good pace. But I think that also the pace is different for everyone else too. So for me, I have a very, very short attention span. I can't keep up with this crap like to save my life. So I decided like for my study schedule, I'm just gonna pound through this at like a steady but like kind of quicker pace. So I do like 80 questions a day. And then just like review Anki cards like every single day. I didn't have like any specific topics to review for a single day. I would just like do the cards, do the questions, get on with my life, do that 7 days a week. And I tried to do that, I think, for like 6 or 7 weeks. And then I just said, screw it. I know what I know. I'm just going to take this dang thing. And then it ended up working well for me. So for those who have similarly short attention spans, sometimes it's okay to just like set a quick pace so you know that like this is a pace that's tolerable to me. It's a little bit faster than what other people are moving at, but like I need to get this done with because I know I cannot last that long. Or I guess that's like my only slight alternate view to it. And then honestly, it felt great having like that extra, I think I had like a month off or something where I was just pounding White Claws in my backyard for an entire month. So I don't know, alternate view on things.
I did want to add something really quickly. I hate to be the person to give you guys like another resource because I know how overwhelming that can be. I don't know if you guys have heard of Divine Intervention podcasts. If you have, like, I don't know, man, it just depends what kind of learner you are, but I feel like I always remember things better if I'm hearing someone tell me about it. Like whenever I would go to one of these Zoom meetings, I'd remember someone's advice a lot better than if I read it in a book or like on a Reddit thread, right? this website, he covers all step 1, all step 2, and he's building up his step 3 library. He has an exam topics list where it has everything already. Think of like almost like Pathoma, but for everything. And usually they range anywhere from as short as like 15 minutes if it's like a rapid review, and a 1 hour long kind of session. And I always felt like it was so much more useful than first aid, because he covers everything in first aid, but he's really good about telling you, hey, look out for this. Hey, look out for that. And I can remember sitting in my exam and like hearing his cadence every time I'd come across that topic. And he's like, he would say, oh, remember this about ovarian tumors. And I'm like, oh shit, that's right. And I just felt, I stopped reading after that, like even for step 2 and even shelves, like it's quick. You can do it in the morning. You can do it on your drive to school. You can do it on your drive to the hospital once you're in 3rd year. I still had first aid as a reference, but I stopped using Boards and Beyond. I stopped using Pathoma because I really felt that cadence was super helpful, and that also allowed me to take down what I considered study time. Like I don't have to be sitting at a table. I can be cleaning my room and cleaning my kitchen, doing dishes, doing laundry, and I'm still studying because I'm still really focused. The cadence really helps you like grab your attention. So even though you're not sitting, and so that helps with wellness, you can get your stuff done. You can go to the grocery store. So if you guys are interested at all, I would highly, highly recommend trying it. It was a resource that I found super late, but I mean, the guy is amazing. He's a genius. I would say he's just as good as the Satar guy from Pathoma. So.
Piggybacking off of that, I've been using Divine for the shelf exams, and I find it would be really helpful. I think for step 1, I'm not sure that I don't know, like he's got more like I don't know, I didn't try it, but I did listen to Golion. I listened to him like probably like 3 times through total, because I listened to him once in the first year and then like kind of again through 2nd year, and then in dedicated every time I ran, I listened to Golion. And I also like I literally heard his voice in my head as I was taking the exams. This is big time boards, guys, big time boards. We're like talking about, he tells like little stories about like, oh, this little white blood cell is going through the body and then it goes to the spleen. And anyway, and that just stuck in my head really well. Okay, so what is our next question?
Oh, another one I wanted to add to, just for like also not burning yourself out. Some people do like a practice test like every single week, and I thought that was like a bit excessive too. Like, sometimes those practice tests, especially at the beginning, they just hurt. Like a lot of times your scores are not where you want them to be, and then like it's kind of it like kills your motivation to see like, okay, I've been studying for like this long, let's see how much I know, and then it's not nearly what you wanted and stuff. So it's like, especially on the days where you take your practice tests, I'd say like, well, first space out your practice tests. Like there may not be that much of a difference going from week to week to week. And then second, to like make sure that you review your practice test well. And then I'd say like for the rest of that day, just take it off, because your practice test doesn't like take that long of the day, and you're probably going to be so mentally drained after. Although some people wanted to like simulate taking an entire step 1 test by like doing blocks of UWorld after every practice test to like simulate the full exam, and I think those people are masochists. But yeah, try not to burn yourself out with those too much, because I mean they can hurt real bad.
Okay. What did you guys do in regards to UWorld and corrects? Did you make them into Anki cards? Did you write or highlight it in first aid? Did you do pure memorization or other?
I can talk on this. I fall into the other group. I initially started making an Anki deck at first. Then you kind of have to have these moments where you think about how much time you're putting into something and how much you're actually getting back from doing it. And I found that I wasn't even going to have time to go through all of those cards and the other cards that I wanted to do, like keeping up with pharmacology, micro, those things during dedicated. So I kind of jumped ship on that after a few days, and just said that I was going to do it on a question by question basis. If I missed the question, and reading the explanation made me feel like I kind of corrected whatever either misconception or fact I was forgetting or anything, then that was all I did with it. If it was like consistently, I was noticing a trend that I was missing, like Anita said, like ovarian masses, for example, then I had a running like list, and one of my half days, or like one half of one of my study days, was like a week topics, like review time for me. And so that was where I could go back and review the topics that I was kind of consistently missing, or like weaknesses that I was finding for myself. So that's what I did. Yeah, like I said, I just couldn't invest the time in making the deck because I spent so much time making it perfect that I wasn't even going to have time to go through it. And I'm kind of that way. So I decided to jump ship on that.
So yeah, regarding the gold yen, I tried to do that when I ran because all the gyms were closed and it just didn't work. So don't feel like you need to do gold yen. Like he's talking about like carbon monoxide and I'm like about to throw up. I'm like, this isn't going to work. But for UWorld incorrects, so I did an 8-week study prep. And the first 2 weeks I did Zenki the whole year. I reviewed all of Zenki, just like, tried to cover all of it. And then I stopped all the cards. And then I would do, I think Anita was saying I'd wake up, do 3 sets a day, and then do review. And each 40 questions, I did random timed 3 sets till 12. And then I'd start again at 2. The reviewing took me about an hour and a half, 2 hours each one. And that was basically my day, is I do 3 blocks and then 3 reviewing. When I'd miss a UWorld question on my reviews, I would actually go to the Zenki deck because Zenki covered everything, 98% of UWorld. And I would just go to the Zenki deck and I'd reset the card to make it so it would pop up blue instead of green. And that way I didn't have to spend time making a new card. Regarding the practice exams, Andrew, I took only 5, I think. I did 3 NBME, 1 week 6, 4, 2, and then I did UWorld 1 and UWorld 2 within a week. And I thought I hit my stride maybe week 7, and week 8 was just kind of a grind. But don't feel like you need to take like 12 practice tests. I only took 5 and it was perfect for me. But
I think one
just
thing
really
that you
quick.
can't. Oh, sorry. Go for it.
I was just gonna say really quick to Eric, how much of Zenki did you have unsuspended by time? So I did Zenki throughout the entire year. The only resources I ever used were Zenki and UWorld, and then I do the nice videos on YouTube. I forgot what they're called, but they're really good illustrations, and I'd do that if I had to clarify, like Katie was saying, if I had to look up a question, I would go watch the video. I think I had all the Zenki decks at least reviewed, but I never kept up with them just because. So like if cardiology was in the beginning of the year, starting at week 8, I started going through all the past Zenki decks, and honestly, that was probably the worst part of dedicated because I was trying to do I was doing like 8-9 hours of Zenki a day and I was burning out. But I think that base from Zenki, when I got through all of it, really solidified the material for me.
Yeah, I mean, for those who are doing like the Zenki and the Anki decks too, I think it's honestly a great way to review a lot of the UWorld stuff, because like whenever I get a question wrong, I would think, okay, what was the main idea of that? And then I'd like look up the 1 or 2 or 3 like keywords or something, or like a disease I didn't know, and I'd look at it and see if it's in this massive deck of 30,000 cards. And I just kind of figured like chances are, if it's not in this massive deck that should be all encompassing of the medical knowledge that I need for step 1, if there's not a card in there, I'm just going to slap it with a low yield sticker and move on, because I can't know everything in this test. Like, I think it's really, really, really easy to get sucked in to be like, oh my God, I didn't know that fact. And that's the reason why I didn't get this question right. I have to know this dead cold for step 1, but there's only so much you can learn. There's only so much that you can retain for that test. So make sure that it's like, yeah, learn the facts, make sure that you're getting the most high yield ones, but don't kill yourself over knowing every single little minute detail, because that's an easy trap to fall into as well.
Yeah, and I would say like So when I was doing dedicated, I didn't really, I did my questions in the morning. I would do like a block and then review it because I don't know, my brain forgets what I was thinking when I went through questions and I sort of get lost in it. So I usually would do one block, then review, and then do like another block and review, and then like lunch, and then kind of chill for a little bit, and then do Anki in the evenings. And then if I had time, I would go through a video. But keeping up with those cards is really hard, and it's hard to get through videos. I know a lot of people, they're like, oh, I'm going to go through all of Boards and Beyond again during dedicated. I'm going to go through all of, I mean, I would tell you to really reconsider that, because you really, what you need to be doing during dedicated is to find your weaknesses and just attack your weaknesses. So like what Mitch was saying, we're not going through every single Anki card in the deck all over again. We're finding the ones that we're getting wrong, and we're going to use those, because if you got it wrong once, you're more likely to get that one wrong again. So really just try to focus on what works for you, but keep that in mind that you cannot review everything again. At a certain point, you have to be confident in yourself. Endocrine was a good block for me. So I'm going to go with, I think I know endocrine relatively well, and then just move on from there.
I agree with Pascal, Drew, and Mitch. Like, that was my problem. That was why I wasted so much time of my dedicated and had to postpone my test like 10 times, was because every time I'd get like a 60 or something, 65 on UWorld, and I saw that most of them would be like cardio, I would literally start from the beginning of cardio and first aid or pathoma or whatever and go all the way through. And that just wasted so much time, because what I was looking for without knowing it was, again, positive feedback. When we would get to, congenital heart disease, I would know that really well. And so I would feel really good about myself. And so, but that doesn't help you. I agree with them. Like, study as much material as you can up until dedicated, and then pick your one resource that's going to be your review resource, and then bang out a shit ton of questions. Like, that's what I would do. I think that if you can get past the whole graded assessment thing that UWorld gives you, you'll be in a lot better shape. You'll learn what you got. If you got a question wrong, study the question and then you learn it. You don't have to go back and go through all of cardio or all of GI like I did, because that was a huge mistake, wasted so much time. And I echo what everyone said about, you can't, I think Drew mentioned it a lot. You cannot know every single fact. So stop studying that way. You have to be able to trust your instincts and be able to at least, if you know one ovarian tumor and you know that one really well, I don't think you necessarily need to know the second and third, for example, because at least if you didn't remember it, you can rule out, oh, this one has high, what is it, AFP or whatever, you know what I mean? And you should be able to have a little bit of deductive reasoning. I think that's the skill that I developed way later on than I wanted to, but you need to be able to do that. Don't focus on the little facts, because at the end of the day, that might get you one question right, but that strategy is not going to work really well in the long run. So.
Does anyone, so we have one more question from the email, but I want to make sure that we answer the questions of you guys who are here. So just opening it up to you guys, like, is there anything that has come up for you that you want to know the answer to right now?
I have a question. So I have my dedicated setup. I think it's like 6 or 7 weeks. But everyone has said, once you hit a point and your score stagnates, like, just take it. So I guess my concern is, what happens if my score stagnates at like 4.5 weeks or 5 weeks? Like, can I move my test date, or do I just need to calm down? Or like, I feel like the same thing kind of goes for postponing your test too. I don't know if you guys had any thoughts on that.
Just really quick. Go ahead, Katie.
Sorry, go for it.
I was just going to say, the stagnating, I don't know how I would judge that, because like my first NBME was good, and then my next two I dropped like 10 and 12, and I was like, what is going on? And I had like put in 3 or 4 weeks of dedicated, you know, so don't let the scores necessarily like you're stagnating, because I would just tell myself like I'm doing like as much as I can. There's literally no way like I could be learning like I know I'm learning. So I wouldn't be too concerned about scores stagnating. Don't look at your U World percentages. You have bad blocks. My scores would sometimes vary 15-20%. I'd have really good days. I'd have a span of like 4 bad days, and then I'd have a span of 5 good days. So don't look too much into that, personally, in my opinion.
Yeah, someone told me very early on that their score was like in steps. So they would go up 10 points and then they'd just be there for a little while. And then they'd go up 10 points or 5 points or whatever, and then they'd just be there for a while. And that was exactly what happened to me. I was like at one place for a while and then I went up. I think what you start to realize is that there are like broad topics that you're going to get on the exam, but you don't know exactly what in those topics you're going to see. And you might get a form that like really plays into your weaknesses or your strengths. So like one individual NBME assessment is not like representative of exactly what you know and what you're learning. So yeah, exactly what Alexa said is
I think,
yes.
Sarah, you have to be able to identify what your target score is first, right? Like, let's say all you want is a 240 and you're struggling, you get like a 205, then you drop down to the 190s on the second one because it's harder, and then maybe you go up a few points and you're still in the low 200s. Then you might get a 220, then you get a 230, then you get a 235, then you get a 236, then you get a 234, and you have like a week or two left. It really depends what your target score is. I would feel comfortable if I was only shooting for a 240, taking it when I was consistently scoring 234, 235, 236. Now, if you're looking to score a 260, it really depends on, number one, just how inherently good of a test taker you are. Because I think what people notice is that getting from a passing step one score to, say, breaking 230, it's really just a knowledge thing, right? You need to have a baseline amount of knowledge that you know. But once you start breaking into the higher averages, you want to crack 235, you want to crack 240, you want to crack 250. I think that's a lot more weighted on critical thinking skills at that point, right? And that's not something that necessarily develops in an extra 1 to 2 weeks, right? That's something that you either I have identified early on, been working on it, consistently working on that as your test taking strategy and not necessarily the content. So I think it really varies. Identify what you want, and then know that you don't necessarily have to get a 245 to be like, okay, that'll guarantee me a 245 on step one. You can hit a 240 because usually most people do fluctuate plus or -5. The majority, 65, 70% of people do actually go up to 5 points. The NBMEs aren't as accurate as people think. There's no clear transparency with them. I think you should treat them pretty similar to UWorld with a little bit more weight on like where you're at. But unless you do what people say, take a full length exam, either take 2 NBMEs or take an NBME in UWorld. And even then, now you're doing 2 different test taking strategy or 2 different testing banks, right? UWorld asks questions a little bit different than the NBME does. So unless you did it that way, I wouldn't rely too much on what the plateau is.
Any other questions from the crowd? Okay, we have one more question from the email, which was, I don't have my email up. It is, how much info did you realistically have to relearn once you got to dedicated? Obviously not ideal, I understand. And I think we have kind of covered that. And I think we all went through the same thing, which is I'm going to relearn everything. I'm going to listen to all of Boards and Beyond again. And then you're like, oh, actually, I can't. This is not enough time. And so you need to identify the things that you really actually need to relearn. I wanted to just talk about like the Anki deck that I made in case anyone is a weird Ankier like me. So I did not mature light year or anything. I did light year over the year and I never kept up with my reviews between blocks. And then when I got to dedicated, there were some facts that I still needed to learn, and there were things that I'd forgotten. Basically, as I got through my incorrects and I would make cards on those. I started a new deck for Sketchy Farm because I found that I was kind of weak on just knowing drug names and what they do. And I was also weak on biochem because we didn't really do it over the years. So I put like biochem, Sketchy Farm, and my UWorld incorrects into this big Frankenstein deck. And I did as many cards as I wanted to do that day, which usually was like about 100 or 200. Only new cards, didn't really go over the reviews, just kind of like hit those topics every so often, and didn't ever see all of the cards in the deck. And that worked for me.
Yeah, for me, I was one of those people who like pretty consistently kept up with their deck and the reviews throughout the year, and then like I didn't study any other new things during dedicated besides what I was getting wrong on UWorld or the NBME exams. I just kept up with those cards, had no structure besides that. The only thing I will say though is that I did leave like biochem, did not care about it until like maybe the last 2 weeks or last week and a half, and then like through some combination of stress and Red Bull, I managed to like learn the entirety of biochem in the last week or two, and that worked okay for me. But that's just because I think like biochem is so incredibly easy to forget that if you try and like learn the entirety of it really early on, it's so easy to forget the pathways. So I mean, my only thing is like make sure that you're pretty fresh up to date with the biochem close to your exam day, because once again, it's so easy to get mixed up with those pathways.
I kind of feel like whatever you review in the last week of your dedicated is like what you feel like is the most on the test. You're like, yeah, I definitely had a bunch of questions on that because I did biochem, and I was like, my test was all biochem.
I will say, as far as like relearning goes, I guess it kind of depends on like your own definition of it. But I felt like topics I had to like relearn were things that I just didn't hit very well the first time around. And then on top of it, sort of seeing it in a new way, like getting questions that I guess I had never thought of that concept before. So I felt like by the end of UWorld and dedicated, there was probably like 15% of it was like a relearn thing for me, where I would see a topic and I'd be like, oh yeah, that's a topic that I should know more about. And that sort of felt like that. Whereas new topics were probably like maybe 5%, like never heard of it, no idea what you're talking about, super confused, couldn't find it in Zanki, stuff like that. So you're going to see stuff that you're like slightly unfamiliar with, and I think you just have to be open to that and figure out, okay, am I more familiar with it now that I've read it again, or do I really have no idea what this is talking about?
I would say just really quick, if there's anyone that had anxiety like me about like what the test looks like, I could never find out online like the format of like when you get your breaks and stuff and how that works. Um, I watched the Dirty Medicine, Dirty USMLE video on like the best way to take the test. So I'd advise doing that, but you have an hour break through for all 7 sections. So you can take a break after each one. And that's kind of what I did. I take a break, get up, you show your ID, but it happens all in like 45 seconds. Show your ID, you can get out, walk to your locker, get a drink, go to the bathroom. And I did that after every single one. And I still had like 20 minutes to spare at the end, but it's a running break clock. So you can time it. I took it with someone that I won't say. I finished my 5th block and they were like, all right, have a good rest of your step one. And I was like, dude, you have 2 hours left. So like, you can go at your own pace. But timing wise, I thought the timing was just like UWorld. I'd finish with like 4 minutes left and I'd have 25 marked and I'd go through and then I'd get up, show my thing, step out. And then when you come back, you just get scanned in. Just to ease any anxiety. I thought Prometric did an excellent job for step one. So if anyone's like, oh, the testing center, what do I do about that? Just a side note that I couldn't find anyone to tell me what it was like during dedicated because it was during lockdown. And I was like, where is everyone?
Did you guys take that sample prometric exam that they offer? And if so, did you guys think that was helpful?
I didn't, and I don't know people that did, because it was a little weird with the pandemic. There was like a lot of spots that were closing in Prometric. I don't know, but I didn't think it was necessary for me, and I was kind of anxious about it.
Yeah, I think you'd be hard pressed to find anyone from our year that was able to get it because, like, I don't know, at least for me, my actual exam was canceled 3 times by Prometric. So I had no, I didn't even like know if I was going to have an exam date. So they did, I don't even know if they opened up like the option to take the practice test at the Prometric for our class because, like, literally, I think for some point in time it was like, okay, your earliest you can book your step one is going to be like late October through December. So yeah, but I think online though, the free 120 was like a good estimation of that. Like for me, I sat at my desk and made sure that everything was on silent, like put my mask on as if I was going to take the test in a Prometric, and then just kind of pretended that I was taking it like that. And that seemed to work.
I took it. It's just more practice questions and another like simulation thing, right? So like if you feel like you need it, I just wanted more practice questions. So, and those are actually written by the people that make the real exam. So it was just another thing where if you can do it, great. If not, again, I agree with Mitch. I don't think it's necessary, but it's a good simulation for sure.
What did we all do for self-care? Personally, I played through every night. My fiance and I would play through Luigi's Mansion when I was done studying for the day. So we'd like play through Luigi's Mansion, and then I took a day off every week, and I went running as much as I wanted. And it was like really essential for me personally to just make sure that my mental health was taken care of. I don't know if any of you guys relate to this, but like I took the MCAT twice, and the first time that I took the MCAT, my practice scores were great, and when I got to the actual MCAT, it was like being an ice skater at the Olympics, and you fall in front of the judges and you cut your arm open and you're like bleeding on the ice because like my anxiety was just like here. And the second time that I took the MCAT, I was like way more relaxed, and I made sure that my mental health was like dialed in. And so that's what I did for step one as well. And it really, I think it helps a lot.
For me, I mean, throughout the year, I usually go to the gym to as a way to like blow off steam, but that wasn't really an option in the pandemic. So I bought two 40-pound weights, sat them next to my desk, and then did a set of curls in between a couple of Anki cards. So yeah, I don't know. I just try to take like at least an hour or so every single day to like get some exercise in, go outside, pet my dogs. Um, but yeah, just it's like literally just the littlest things every single day. Like as long as you have a consistent like bit of time where you can unwind, like blow off steam, vent whatever frustrations that you have, even if it's like to your parents or your dogs who can't talk back, like just something every single day to make sure that you're like taking care of yourself.
Does anyone else have any questions? Okay, guys. Well, so we are all available, I'm sure, by email. We can leave our emails here if it would be helpful, or whatever. And we're gonna try to put together maybe something that we could do weekly for you guys, and have like just a opportunity for you to come in and drop by with any questions that you have. It won't be something that'll be formal, but it'll be like some of us sitting on a Zoom meeting, and you can just come by. As you go through dedicated, you'll have more questions. You'll wonder if what you're experiencing is normal or what to do, or if you need to push back your test, or if you need to take your test right then, like what's going on. And so we've all been there. And so I think it would be helpful for one of us to kind of like sit there, or at least have us be available via email or something. So yeah, feel free to reach out at any point. Other than that, good luck, you guys. You'll do fine on your CBSE. You guys will get through the next few weeks and it will all be okay. I promise.
Thank
right,
you
thank you.
guys so much for being here. I'm gonna send, there's a couple people I think that wanted to make it but couldn't. So I'm gonna send them the recording. Can I just put your guys' email, like CC you guys and just say anyone CC'd on here type thing? Okay, cool. Thank you guys again so much. This was really helpful.
Yeah, no problem. Bye.